Hi, I'm Kelly Engelmann. I'm a family nurse practitioner certified in anti-aging medicine. I have a clinic, Enhanced Wellness, in Jackson, Mississippi. We have an integrative approach to wellness where we look at traditional medicine as well as integrating other aspects of wellness into the practice. And our goal is prevention, so we're heavily focused on nutrition and exercise. And we do some specialty testing as well to help focus patients on their healthcare goals. I became interested in wellness early in my career, but just didn't have the venue to actually learn about anti-aging medicine or even really understand what anti-aging medicine was. So when I learned about A4M, I quickly got on board with attending the fellowship modules, and the knowledge that I gained here I was able to take back to my practice and implement right away, and I like that. I'm also involved in the master's program through the University of South Florida, and so I think A4M is a great way to expand your knowledge when you really want to help your patients with prevention and with anti-aging. What I've learned here through A4M is the depth and breadth of testing for functional medicine. And some of the things that we've been able to implement in the practice at Enhanced Wellness, we do saliva testing for hormones, where we're looking at stress hormones as well as female and male sex hormones, as well as melatonin for sleep. We also look at food sensitivities through testing. We look at nutritional deficiencies through functional medicine testing. It's very individualized medicine, and patients like that. They like to know where they are, and then we can ascertain what their goals are, and we can direct them and keep them on track, because they can pick up a magazine one day and it says vitamin C is good. 2 days later they pick up another article that says it's not good. They're very confused about which direction to go. So if they actually know where they are, and we can help them understand foods to eat, supplements to take, lifestyle changes to make to help facilitate their goals, they get there a lot faster and feel much better. We use bioidenticals for patients primarily during the perimenopausal period or menopausal period, sometimes prior to that, but patients are looking for bioidentical hormones. They want to know where they are hormonally, they want to be tested, and they want to be balanced. And so that's what we do. We measure hormones through salivary testing most of the time, and then base their hormone dose on what they actually need. We work with our local compounding pharmacies to customize a dose for them that's individualized, and then we monitor them over time so that we make sure that we're keeping them balanced. We would never just put someone on a dose and leave them on that same dose without follow-up testing and monitoring to make sure that we're keeping them in optimal balance and decreasing their health risk. You know, most people that think of hormone replacement therapy think of it in relation to symptom relief, but it goes much beyond that. It goes for osteoporosis, dementia prevention, Alzheimer's prevention, and so much, much more than just symptom relief. In Mississippi, we have over 33% of our population obese. And so that's something that I'm very passionate about, is preventing obesity and helping to correct metabolic syndrome. There's a variety of ways we can do that, but that basically goes back to lifestyle changes and looking at where they are metabolically and being able to help them correct their metabolic imbalance. So looking at glucose load, so we use a very low glycemic index for a lot of these people, low glycemic index diet, as well as exercise plan, and then looking at sleep. A lot of these patients have sleep issues and they're not even aware that they have sleep issues. And unless we correct their sleep problem, a lot of times we're not able to get them metabolically stable. And so it's a very much a customized program for that patient. One of the things that we implemented in our practice April of 2011 was precision therapy for hair loss. And the reason we did that was we had women coming in just devastated over hair loss. And I wanted to find something that was safe and effective for these patients, in addition to getting them balanced nutritionally and hormonally, that would help with hair restoration. So we implemented that in April 2011, and it's really been an amazing thing for these women to be able to see hair regrowth with no side effects and really see some changes within a 6-month period. So that's something you should visit our website to get additional information. It's something that's available right here in the Jackson area. If you would like to know more about Enhanced Wellness, go to www.enhancedwellness.com.
A4M's Longevity Magazine e-journal is your weekly online e-newsletter featuring great articles on wellness, prevention, and biotech advances in longevity. To get A4M's e-journal free of charge, go to the A4M website, worldhealth.net, and sign up on the homepage. It's free.